I moved back to surgery in November 2015 and I was inducted using the induction booklet created by Kerry CSRG Group, which I found to be very useful. I'm now part of the secretarial CSRG group and I find this is a good platform to share ideas and learn from other areas.
Hi, I enjoy being part of the Ward Clerk CSRG group as it gives me the opportunity to link with all areas of the hospital to improve relationships. It also allows me to encourage staff to input into TMS effectively and to help answer any queries they have in relation to this.
Hi, I'm Julie White. I work in A&E reception at the Ulster Hospital. I'm here just to say a few words about the CSRG meeting that we had. We found it very helpful to meet people from other areas of the hospital and try to work better together and how each department worked and how they all fitted together. We also found it very helpful. We had an issue within the office with the reception desks being too high and the seats being too low, basically, so people like myself who are quite short had difficulty reaching over the desks and integrating with the patients. The outcome of the meeting was that the desks were lowered to the correct level, and we also got new chairs which went higher up so that we were able to work more comfortably, and it stopped a lot of issues with back problems and shoulder problems. So we found the whole meeting very helpful for us.
I'm Jenny Halloran, Medical Secretary in Obstetrics and Gynaecology in the Ulster. I feel CSRG over the last year or so has given me the platform to discuss secretarial workload outside of my own office environment to get other people's opinions. It's developed better ways of working and new ideas. I feel it's brought to light what we are good at and areas where we can improve. It's made me feel that you're not alone and every department is facing the same challenges as I am.
This is a special year for clinical coding, 25 years in Northern Ireland. And it's special because the board are trying to promote the role regionally of the clinical coding. The clinical support group provided us an avenue to make people aware of the role of the clinical coder and what's expected within our trust and coding generally within the 21st century. The support group enabled us to cover areas of difficulties that we encountered in our coding roles, areas of insufficient information on source documents, discharge letters, case notes and relevant test results that helped us complete a primary diagnosis. Transferred patients on PAS incorrect also caused delays in coding a completed episode. And meeting strict deadlines which we have regularly set down by the board regarding 3 months discharge target date down to 2 months. And you know, getting this information was providing difficulties in these areas, but at least with the clinical support group, we could bring these problems to the fore, and these issues are ongoing, but we are working towards resolving them.
The clinical coding support group enabled us to bring the role of clinical coding to various groups of staff within the hospital, namely clinicians, health records, secretarial and ward admin staff. It enabled us to get slots on the doctor's induction days, which helped us promote the role of clinical coding so that we could get better information on the discharge letters that we receive. This is still ongoing, but hopefully we will be able to achieve better results from this. The group also enabled us access to computer systems which we didn't have before, namely the theatre management system for surgery and the EAM system for A&E. These are all helping us in the clinical coding process. We also sat on other groups within the clinical support reform, namely the ward clerk group and the secretarial group, and it was good to hear the issues that they raised. Some of them were similar to our own. As I said, this is an ongoing piece of work, and it is going to help promote the role of clinical coding within the hospital to ensure that we have a good and future role within the service.